All right, welcome to Sleep Better TV. I'm Scott Drake. My guest is Dr. Mark Laska with Wilshire Dental Care in Los Angeles, California. By the way, he is the team dentist for the Los Angeles Clippers. Dr. Laska, it's a great pleasure meeting you. Thanks for joining us today.
Well, thank you, and it's a pleasure to talk with you today, too.
So you are part of a growing number of dentists who are treating sleep disorders and sleep-disordered breathing. One of the chief and most well-known terms would be sleep apnea, which is something that you do treat. What exactly is sleep apnea?
Well, the actual definition of apnea is without breath, and sleep apnea is without breath while sleeping. During sleep, muscles usually relax, including those that control the tongue and the throat. Sleep apnea is usually caused by an obstruction of the throat, and you stop breathing for 10 seconds or more. The degree of sleep apnea is based on how many times you stop breathing, and usually that's within a 1 hour period of time. If you stop breathing from 5 to 15 times, it is considered to be mild. 15 to 30 times, it's considered to be moderate, and more than 30 times is actually severe.
Okay, and in the case of your typical sleep apnea patient, you know, we've been reading in the news lately about the effects of sleep apnea, and there seems to be a lot of comorbidity with sleep apnea. We've heard of, you know, blood pressure, and we've heard of weight gain and obesity. What are some of the other negative effects of untreated sleep apnea?
Actually, recent studies suggest that stroke, heart attack, high blood pressure, of course, diabetes, dementia, and even cancer are linked to sleep apnea. And because you're more tired during the day, you're usually more prone to accidents, and especially automobile accidents.
Well, what you just talked about are I think the top killers of people. So when you are treating sleep apnea as a dentist, how do you approach that?
Well, usually dentists are often the first in line in the defense of screening and treating patients for sleep apnea. Acid reflux, scalloped tongue, a large tongue and a small jaw, as well as bruxism are all visual signs that a patient may have when they have sleep apnea. In my office, we actually have patients fill out a form that have questions related to sleep and sleep disorders that indicate a patient's risk for sleep apnea. From that questionnaire, a patient can show signs of risk. We actually offer a complimentary home sleep study. And from that study, we can get an interpretation of the patient's sleep habits, including how many times they stop breathing, their oxygen levels during sleep, and if they snore and how loud they snore. And then from those readings, we can give our patients recommendations and the proper referrals to get treatment.
Okay, and in some cases, too, you are the first line of treatment here because, you know, I understand that a healthcare professional or sleep person, doctor, would typically prescribe CPAP, and CPAP is the breathing machine, you know, that I think some people have seen. How do you treat it in the event that maybe this is mild to moderate or somebody is not really too excited about using CPAP?
Sure. Well, there's actually three types of doing treatment. Surgery is one option, and that's usually used in more severe cases and as a last resort. The second treatment is, of course, the CPAP. The CPAP is a medical device that forces air down the nasal airway. But CPAPs are usually very effective. But unfortunately, 75% of patients that have one do not use it, and it ends up in a closet. They can be cumbersome, noisy, especially for the bed partner, and can be uncomfortable and cause a rash on the face, and they are difficult to travel with. So therefore, we use a third option, which is a dental appliance. These appliances are FDA approved and are now the preferred method for treating mild and moderate sleep apnea. Also, dental appliances can be used when a patient cannot tolerate a CPAP, even in severe cases. The basic principle of the appliance is to allow respiration to happen naturally by advancing the lower jaw forward. We have found that these appliances to be quite successful, and our patients appreciate their ease of use.
Mm-hmm. And again, talk a little bit in closing here about the appliance itself. This is an oral appliance, and it's a custom kind of a product. How does it fit?
Basically, we take impressions of the patient's mouth. We also take a bite relationship, and we have specialized equipment in our office in order to help us with that bite. We use a rhinometer and a pharyngometer in order to establish the bite relationship and to see the position of the jaw. And based on those things, we're able to establish how far we can move the jaw forward in order to open up the airway. So it's a fairly simple procedure. It takes about 15 minutes to take the impressions and do the testing with the pharyngometer and the rhinometer. And that's pretty much it.
All right, well, Dr. Laska, it's been great talking to you. Appreciate you sharing your time with us today.
Thank you very much.
All right, my guest has been Dr. Mark Laska with Wilshire Dental Care in Los Angeles, California. Another expert featured here on Sleep Better TV.